A few years ago, a family walked into my clinic with a sentence I have heard countless times during my career. Doctor, we thought it was just weakness. Unfortunately, the diagnosis turned out to be acute leukemia. And what troubled them most wasn't the diagnosis itself. It was the realization that the body had been sending warning signals for weeks. The problem is that leukemia often doesn't begin dramatically. It doesn't always start with severe pain. It doesn't always start with visible lump. In many patients, it begins with symptoms that are surprisingly easy to dismiss. Today, I want to share 3 early warning signs of acute leukemia that every family should know. Not because these symptoms automatically mean cancer, but because recognizing them early can make an enormous difference. I am Dr. Ganesh Jaishetwar, Senior Consult Hematologist and Bone Marrow Transplant Specialist. Let us begin. The first warning sign is a very specific type of fatigue. We all get tired. We get tired after work. We get tired after poor sleep. We get tired after stress. That is normal. Leukemia-related fatigue feels different. Patient often tells me, Doctor, I have never felt this exhausted before. Activities that were easy suddenly become difficult. Walking upstairs causes breathlessness. Short walk feels unusually tiring. Some patients notice they look paler than usual. Why does this happen? Because leukemia develops inside the bone marrow. The bone marrow is responsible for producing these blood cells. As leukemia cells grow, they interfere with the production of normal red blood cells, and the result is anemia. Anemia reduces the oxygen supply to all the tissues. That creates profound fatigue. The second warning sign is repeated infections or fever. This one surprises many patients. Patients often assume if my white blood cell count is high, my immunity must be strong. Not necessarily. In leukemia, many of the white cells being produced are abnormal. They may look like white cells under a microscope, but they are not functioning normally. As a result, patients become vulnerable to infections. You may notice frequent fevers, repeated throat infections, persistent coughs, infections that improve and then quickly return. A fever that keeps recurring without a clear explanation should never be ignored, especially when combined with other symptoms. Now let's discuss the third warning sign. This is often the most visible clue. Unexplained bruising or bleeding. You notice bruises on your arms, legs. You don't remember hitting anything. Your gums bleed while brushing. You experience frequent nosebleeds. You notice tiny red or purple spots appearing on the skin. These symptoms can occur because leukemia affects platelet production also. Platelet helps blood clot. When platelet counts fall, bruising and bleeding becomes very common. Now, here is the most important part. Individually, these symptoms can occur for many reasons. Fatigue can have dozens of causes. Fever can be caused by common infections. Bleeding can happen accidentally. But when these symptoms start appearing together, it deserves attention. As a hematologist, I become concerned when I hear combinations like, Doctor, I have been unusually tired. I have been recurring fevers. Now I am noticing bruises. These combinations should prompt further evaluation. The good news is that the first stop is often very simple. A complete blood count, a CBC, one of the most basic blood tests in the medicine. Yet it can provide incredibly important clues. I often tell families, don't diagnose yourself on Google. Don't panic, but don't screw your body either. Medicine has advanced tremendously. Today's treatment for leukemia are far more sophisticated than they were 10 years ago. We now have precision therapies, targeted treatments, advanced immunotherapies, bone marrow transplant techniques that continue to improve outcomes. The biggest advantage we can give ourselves is early diagnosis, because when leukemia is identified early, we can start the right treatment without unnecessary delay. So let me leave you with one simple takeaway. If you notice persistent fatigue, repeated unexplained fever, and unusual bruising or bleeding, don't brush it aside as stress, get a proper medical evaluation. A simple blood test may provide answers all you need, and sometimes acting early changes everything. If you found this information helpful, share this video with your family. One share may help someone recognize a symptom they were about to ignore. Thank you for watching. Stay informed, stay proactive, and take care of your health. Thank you.